Yes, mate. Oh, that deserves a picture.
He's known as the Supervet.
You all right, mister?
That's good. It's going to make you stand again.
Very gently hold that.
His extraordinary vet practice and cutting-edge procedures
Hi, mate. 25 years ago, I would have said it was impossible.
have saved the lives of thousands of the nation's pets.
Oh, that's so good.
Well done, good girl, good girl.
Professor Noel Fitzpatrick and his team are constantly developing new treatments where other options have run out.
All right, all hands on deck. Let's get into theatre now. Nothing about this fracture is textbook. This is totally unpredictable.
And when hope fades,
I'm not telling you that he has to be put to sleep, but I am telling you that we do have some big decisions to... I'm sorry.
Noel continues
All right, let's go.
to search for medical solutions,
I'm not God. I am just a bloke trying to do his best.
Come on then, baby.
offering a chance
I've got my dog back with bells and whistles on.
against all the odds.
It's okay, Baba. It's okay.
I just think it's amazing. Amazing.
Yes.
At Fitzpatrick Referrals, the patients come in all shapes and outfits. From puppies to the more mature.
When I see older dogs or cats come into us, and when you see the little grey faces, you want to look after them like you want to look after your grandparents.
Oh, the old dogs break my heart. No.
Good boy.
But they're so sweet. I love them.
The old-timers get special attention.
They do require things to go a little bit slower, a little extra padding on their beds, a few extra massages, and usually a few more treats.
Good afternoon. Fitzpatrick Referrals, Orthopaedics, Animalogy. Natalie speaking. Can I help?
This morning, an elderly beagle has arrived.
Lola.
Lola is 10. She's been referred with intermittent leg pain. Sarah is worried it may be a recurring spinal problem.
Well, it's apparently it's quite common with beagles. They can have spinal discs that slip and things like that. So we think it might have happened again. But she limps on and off, and then it goes away, and she's fine. And then she was just really ill. So now we're trying to find out exactly what's wrong.
At home in Surrey, Lola is to the manner born.
Well, Sarah and the kids got Lola for me as a surprise present. She's so loyal to me. You know, I get up in the morning, she gets up. If I want to go out, she wants to come with me. She is a very loyal friend. So I get very attached to them type of things, much more than to dogs and human beings. But,
Yeah.
Lola grew up with the family's 2 children.
Good girl. Lola is like my best friend in like the most stupid way. She's not a dog. She does whatever she wants at any time. You can't really control her. And she is just like everything for me. I love her because she's so devious and cute at the same time.
Lola. Lola.
Lola has the run of the estate.
She's the dog who will go into the stables and just drink out of the horse's bowls, whereas other dogs wouldn't dare. And she just sort of looks at the horse and, okay, then.
Yeah.
And she gets on with it.
and then she walks off because she knows he kind of owns the place. A definite worst habit is from about 7 o'clock at night, she goes to sleep and she has got the loudest snore of all time. Can't hear the telly.
But recently, the family had a terrible shock.
She collapsed. We had to carry her in from the yard in a sort of tarpaulin thing. So straight down to the vet then, and he kept her in overnight to watch and just give her pain relief to see if the pain relief would help. And obviously it helped a little bit, but it didn't take it away. So then he's referred her straight away, so straight off to Noel from there.
At the practice, Lola has been having imaging performed on her spine. The family are anxiously waiting for news.
Hi there. Hello, Mike.
Hello there.
How
Hiya.
nice to see you.
Indeed.
Hello. No worries. Now then, So we've done an MRI.
She has pain associated with disc in the neck, and the disc also squished the spinal cord.
Right.
So that is why her tendency to collapse. Okay? So that's the spine. Each of the discs is a fibrous ring and a pulpy center, like a donut.
Yeah.
And when that dries out, either the fibrous ring bulges, squishing the spinal cord and the nerves as they come through these holes, or it leaks. And they've done both. So that's a bulge, that black thing, and the grey thing is a leak, which is why the right front leg lameness.
Okay.
It must be agony.
That's under control now.
Yeah.
She's pretty good now, pretty happy on the painkillers we've given. Now, in Lola, all of the discs are dried out. They're all black. There's not a single normal disc in this dog's back.
Right, okay.
So this is a genetic problem. Now, if the disc is bulging in the neck and explodes, often what we do is we cut a hole through the bottom and suck that stuff out, and then put the spacer in.
To relieve the pressure.
Yes, okay, and that's the point. Then we fuse those two vertebrae together, having spaced them.
Okay, sounds complicated. And do you mean, like, looking at Lola now, she's 10 years old.
You have to make an ethical consideration about what's in the welfare interest of the patient.
Yeah.
And if I didn't feel that an operation could solve it pretty quickly, then I wouldn't be recommending it. There are risks, so I have to tell you that. There could be nerve damage, so she could, have difficulty getting up or walking around after the operation. But the reality is that most of the time, this kind of operation can result in a good quality of life fairly quickly.
Yeah, that's good enough for me.
Yeah.
Yeah.
Okay.
Yeah,
no
good.
worries,
No.
Good to
Thanks
see
for
you.
Andrew, mate.
No
Thank you
worries,
very
no
much.
worries. Good to see you. Good to see you.
The family all want Lola out of pain.
Okay.
So Noel will operate in the morning.
You've made my day.
Among the canine commotion in reception, another senior dog is in trouble.
We're here today because Brandy, our chocolate Labrador, has been diagnosed with having bone cancer and not much could be done. She might have to have a leg amputated, but she's very clumsy, and I'd worry that because of her age, she'd struggle on the other 3 legs.
The family from Staffordshire have had Brandy since she was a puppy.
I always wanted a chocolate Labrador, didn't I? I always said I wanted one. And one time I rang up the breeder and she said, oh yeah, we've got some. And I said to John, and he goes, oh, we're not ready to have one yet. And then I said, just go and have a look. So we went to have a look and then ended up coming back with one.
Good girl. The breeder at the time handed her over to me, and then she looked and she said, yeah, I can definitely tell you're going to get spoiled. And I remember thinking, I can't believe she's going to suggest such a thing. Yeah, 11 years down the line, I now look and go, OK, fair point, you knew us well, because, yeah, she is totally spoiled.
Speak! OK. Right.
She also wants to finish our food, that's for sure. Oh, blimey, doesn't she start bothering you? As if like, right, you mustn't forget me, this is my part now, I want this.
I want them, there you go.
We would do anything for her, I think.
So we can't have children, so she's our sort of substitute child, isn't she? She's very much our baby.
But recently, Brandy hasn't been herself.
So one of the reasons we knew that Brandy wasn't very well is that instead of sleeping next to us, she started sleeping downstairs by the front door, didn't she?
Yeah.
Oh, no. And then we had an occasion where she just refused to walk and had to take Brandy back home on my mum's scooter.
Yeah, you could see something was getting worse.
They were referred to Fitzpatrick's Cancer Centre, who diagnosed a tumour.
Good girl.
We're really hoping that the cancer hasn't spread, and we're really hoping that something can be done. And even more ideally, push it, we can save her leg.
Today, they are discussing Brandy's options with Noel.
Now, Brandy Winter, please. Hello, I'm Noel. Nice to see you. Grab a seat, guys. Good. Now then, hello, mate. How you doing? Hello. Now, I know you've seen my lovely friend Laurent at our other hospital.
Yes.
He scanned the leg, the skeleton, and the chest. In the leg, there are very obvious big holes in the knee.
Oh, wow, yeah.
Yeah,
See
yeah.
that? Yeah, very much.
It's like a moth flew in there and ate away the fabric, and that's why it's called moth-eaten.
God, dear me. Didn't realise it was that destructive.
It's very destructive. So the second piece of information that we have from Laurent is that he stuck a needle into this, and he sucked some cells out. And this is the report, which says, as you can read, the report suggests low-grade chondrosarcoma, which is a tumour of a much better prognosis than osteosarcoma.
A chondrosarcoma is less likely than other, more aggressive bone tumours to have spread cancer cells around the body.
And Laurent has done a full workup of the chest. From that CT scan, you can tell that the tumour is pretty well confined within the femur.
Noel can't be certain, but with no obvious signs of cancer spread, by removing the tumour, Brandy could potentially be cured.
Before you came, what you don't realise is that we have to have a full ethical review of the case. We've already done that, and we've come to the conclusion that it is ethically appropriate to treat the case, and that there will be two fundamental options: full limb amputation or limb salvage. The vast majority of veterinary surgeons would automatically recommend full limb amputation. Dogs do manage well on 3 legs, and the quickest route to the exit for any dog with limb cancer is a full limb amputation. At the moment, there's very few that offer limb salvage. I don't know of anybody offering custom knee replacements at the moment in the United Kingdom apart from us. Do you personally have views either way?
She's quite clumsy. Even as a puppy, she used to fall over on her front paws. And that's why I'd rather, save her leg if possible.
To save Brandy's leg, Noel will need to design a custom-made bionic knee. It will take 3 weeks to manufacture.
So the next step, let me do a physical examination. Up you get. So I can feel the tumour in there. I apologise if this hurts.
All right, lovely. Okay, all right, darling.
But Noel has noticed another problem.
So we got to treat those ears to begin with. One of the big problems with any implant surgery is infection anywhere else in the body. And sometimes they have bugs in their system that then may seed in their bloodstream and could go to an operation site.
True.
Come on, mate, you come with me. We're going to
Brandy will be treated for her ear infection.
On a different lead. You come back.
Only when it's cleared will she be able to have her groundbreaking knee operation.
Well, I'm hoping that she can be treated, but it's always scary, especially when you've got an older dog going into surgery, in terms of how they'll cope. But I think if you compare it to the fact that she's got bone cancer, we've got no choice, really.
We might have to take that unit in with us because I think it's the one from theatre.
In the prep area, Lola, the 10-year-old beagle who's been collapsing on her front legs, is ready for her spinal surgery.
Lola has one disc which is causing the major problems and another disc just behind that which is high risk, so it may cause problems in the near future. So what I'm going to do is I'm going to distract and fuse both of those sites.
Noel was the first to develop this operation for animals.
All right, let's do it.
To get access to the affected discs, he's going in through the underside of Lola's neck.
So I check where I am by feeling the first rib, and then I know where the positions of the vertebrae are relative to that.
He drills 2 pins in the vertebrae so he can pull them apart with a spreader.
As you can see, the disc space here is now opened up. So this is the disc that's most bulged. So I'm going to use this device, which is like a toothpick, to go down and scoop the material out. And we're hitting blood there because there's a venous sinus.
The venous sinus drains blood away from the central nervous system. It's very thin-walled and is easily damaged.
When a venous sinus bleeds, you can't stop it. You just have to keep scooping until you have as much as you can out. And then you've got to stop because we would lose too much blood and that could be potentially life-threatening. So I've got to block the hole now because you can't stop that bleeding.
Having removed as much disc material as possible, Noel places implants into the spaces where the discs used to be.
Okay, so we've got 2 spacers in there now. So now when we release the tension on the pin distractors, the vertebrae should stay exactly where they are.
Noel drills 8 pins into the vertebrae and packs bone marrow around the spacer implants.
Okay, so we've got the bone graft in now, and it's placed around the spacer devices here, 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 and here to fuse those vertebrae together.
Cement will provide stability until the vertebrae fuse.
So that's the cement all set now, and we're just stitching up the muscle over the cement and we're done. Right, Lola, there you go. Let's go to X-ray. Thank you.
It will be several days before Noel knows if the spinal cord will recover and Lola is out of pain. For now, rest is the best medicine.
There we go.
Hi.
What a princess. Oh, bless her.
In reception, an emergency has just arrived.
Oh, darling.
Lisa and Brian have brought in their injured puppy, a young bulldog called Molly.
This morning, Brian took Molly to the woods for a walk, and when he went to the van to get some wet wipes, she sits at the little rubble, and a lady pulled in and hit the side of her.
We took her straight to the vets.
But they still don't know really what her extent is at the vets, because they said they need specialist x-rays and a specialist to see her. But she's definitely got a fracture on the front joint.
She's only 20 weeks.
Yeah.
20 weeks old,
she's 20 weeks, she's a baby.
Kate is a friend's daughter. She's very close to Molly.
She does everything for you, doesn't she, Kate? But when Kate comes round, she has her running around and doing all sorts, don't you, Kate? She loves Kate.
Come straight in, guys. Come on in. Sorry about that. Please take a seat. What's your first name, ma'am?
Lisa.
Lisa, I'm sorry about this. What's happened?
She got run
Hello,
over
mate.
this morning.
Okay, what time?
11.
Okay.
Come on, Molly. Be a good girl.
Okay. I need to give more methadone now, but we do have some pretty serious injuries here. So I'm just going to check that out right now. I think we better just crack on. I'm sorry. I'm sorry. It's okay.
Oh, Mummy loves you. Be a good girl, Molly.
She's a brave girl.
All right, I'll be with you very shortly. Let me just get this situation under control. What nurse is with me, please?
The team must stabilise Molly before they can perform more detailed imaging.
So can we get a proper weight check and get some methadone on board? We'll decide what to do. So from what I can gather from the x-ray pictures that have been sent in by your vet is that she's got a fractured front arm on the left-hand side, and she's got a dislocated hip. It's not clear on the x-ray pictures which side that is. And out of those two, the most painful is the fractured arm.
Yeah.
So that piece of bone should be connected to that piece of bone. It's broken right across. So basically the bottom part of the leg is flopping.
Oh, God.
Almost certainly we will stabilize her now and keep her as pain-free as possible overnight to make sure that she doesn't have any life-threatening consequences with regard to her chest or her abdomen right now. But we do need to operate at some...
quick.
Yeah.
She might come recover all right, mightn't she?
Most dogs with this degree of trauma do recover, so this is not a no-hope situation.
Okay.
Okay?
Yeah.
So I actually don't know what we're going to have to do yet.
Yeah.
So I'm going to have to assess the situation and let you know that by telephone later tonight, okay?
Yeah.
All right, stay brave now. Okay, guys.
Thank you very much.
I'll talk to you later.
Oh, lovely,
Thanks.
thank
All right,
you.
bye-bye.
He doesn't want to operate until she's gone through 12 hours, say. And then in the morning, he'll have a better judgment whether to do the operations or so forth, because she might have something that he can't see with the organs or anything like that, you know.
I'm just so hoping he phones me and tells me nothing has happened between now and the time we get home.
3 weeks ago, Brandy faced losing her leg due to a cancerous growth. Today, though, her ear infection cleared up. John and Helen hope her leg can be saved by cutting the tumour out and giving Brandy a custom-made bionic knee.
Now, Brandy Winter, please.
Oh, come on, my love. You're all right. It's okay. You're safe.
Hello. Nice to see you. Grab a seat, guys. Hello, mate. How are you? Now then, so tell me, how are you emotionally at the moment?
Nervous, but relieved and, like, hopeful, really.
Now, this is your implant, my friends. This is the first and last time you'll hold it. The hope is that we're going to completely excise the tumour, i.e. that it's all gone.
All gone, hopefully, yeah. What are the chances of, like, infections or anything like that?
Obviously, it's a sterile procedure, and obviously we do everything humanly possible to prevent infection, but it is possible that infection could happen. We just hope it doesn't. Bone fracture or failure of the implant is a possibility, but again, not a high possibility. Right then, sweetheart. Now, big cuddle.
You'll be right, love.
Hey. Now, sweetie pie. Good girl. All right, guys, I'll call you later.
Yeah. Thank you.
Bye.
Brandy is prepped for her surgery. It's a groundbreaking procedure, but if successful, it may save Brandy's leg and allow her to walk pain-free once again.
All right, do our best. Incision.
Noel will move the kneecap to one side and, using a plastic guide, cut out the bottom part of Brandy's femur with the tumour inside it. He'll attach a custom-made metal implant with 6 screws. Then he'll cut the joint surface off the tibia and insert a second custom implant secured with cement. Finally, he will articulate the new knee joint using a polyethylene bushing on a peg and axle system.
Hold that. The tumour is growing inside the bone here, where that bump is. We're now going to put the guide on. Hooks around the bottom of the femur, tells me how much to chop off.
Noel must dissect the muscle away from the femur.
We've got to be careful back here because there are major blood vessels. Okay, so we've cut the tumour out now.
The tumour will be sent to the laboratory for analysis. Now Noel can start attaching the implant.
Okay, so this is how the knee works. We put this piece of plastic onto the tibial component, and we put the femoral component on there. Put an axle through here, and that's the knee replacement. We can just push this implant on because it's already pre-measured, and the screws in the plate that go up along the side are all in predetermined spots as measured off the CT scan. Give me the 2.7 cm screws over there.
Noel secures it with 2 temporary screws.
Okay, give me goggles, please.
With the top part of the implant in place, Noel prepares the tibia to receive the lower portion.
So we've cut the top off the tibia, and now we're scooping out the marrow to put the stem of the tibial component down there. Okay, so we're going to check alignment. Push in. Right, we can work with that.
With everything in line, Noel replaces the temporary screws with permanent ones.
This looks good. That's rock solid now. You can lift the whole dog off the table with that. Right, tibia next. Stay there.
Cement will hold the lower part of the implant in the tibia.
So the tibial component is now in place. We put this plastic component on there, and then we're gonna put everything back together. Don't let it pop. Watch it. So we'll put the kneecap back in, and we can see it flexes and extends, and also there's some rotation. Okay.
Give me some size 4 metric PDS, please.
It's taken over 2.5 hours to give Brandy a bionic knee. But she'll need 3 months of physio and hydrotherapy for the muscles to recover.
Right, Brandy, that's the best I can do, sweetie pie. Let's go to X-ray, please. Alrighty. Thanks, everyone.
You're okay, little one. You're fine. I know, baby. I know.
Molly, the bulldog puppy who was hit by a car, is still in a bad way.
Heart rate of 180.
Noel's team have been monitoring her.
Oh, her lungs sound awful.
So let's get the rads. We'll
Yeah.
stabilize overnight and then we'll cut tomorrow if we can. Thanks.
Noel wants some high-quality X-ray pictures to see if Molly has any life-threatening injuries.
Oxygen is running.
You can go that way.
Let's try and get this done quick.
Molly has a fractured arm and suspected hip dislocation. Now she's developed an elevated heart rate and laboured breathing.
We need to keep a close eye on her respirations. Okay, quick, let's get the pelvis. She's not doing as great as we want her to be. I think it's been better now that we've I elevated her head a little bit.
Let me have a look. So unfortunately, Molly is affected by several genetically mediated issues. She's got slipping kneecaps on both sides. That's the kneecap in, that's the kneecap out, in, out. She also has very loose hips as a result of hip dysplasia. As she developed over the last 20 weeks, the tissues around her hips did not hold the head of the femur inside the socket, and it slipped out, and unfortunately it's on both sides. The only leg she doesn't have anything wrong with is her right front leg. Her left front leg is broken. I'm going to have a serious chat with the family about her back legs and the prognosis for that.
She also has a really dysplastic trachea. It's worrisome for her.
Does she have brachycephalic airway syndrome as well? Let me have a look.
Brachycephalic airway syndrome is common in short-nosed dogs.
That's not good.
Genetic abnormalities affecting the soft palate and windpipe can leave an animal struggling for breath.
Susan, can I ask your opinion on this dog, please?
Susan is a senior surgical specialist in orthopedics and soft tissue.
And can you check the soft palate for me, please?
What age?
20 weeks.
So she's bad, and she's only 4 months of age.
Yeah, the soft palate is really getting stuck on the epiglottis there.
Noel has also asked senior surgeon Porrick to look at Molly's images.
Tricky is that? Yeah, absolutely tiny.
So and the sucking in of air is causing some lung change as well.
Yeah, it looks like only the effort of breathing. She's breathing through a tiny drinking straw, so that the airway pressures are altered, and I think that's a pretty tough one.
Yeah. What has happened here is 3 things really. The windpipe is really tiny. It's less than 5.5 millimeters, as opposed to a windpipe which is, say, the size of my thumb. The soft palate is really long, and it's catching on the epiglottis, which is at the top of the windpipe, at the top of the trachea, and it's causing air turbulence. And basically, the lungs are trying to suck air through effectively a drinking straw. And so the lungs are being compromised as well. So this is a very complex respiratory disorder. And it does significantly affect Molly's prognosis, unfortunately. It's even a risk waking her up now because she's had a very stressful day. So long soft palate, very small trachea, lung issues, hip dysplasia, kneecap dislocating, and a fractured arm. She's on very thin ice now. I'm going to have a whole different kind of conversation.
Her blood pressure is stabilizing.
All right.
Molly, the bulldog puppy, has been anaesthetised. The team have made some worrying discoveries. Noel is calling the family.
Hi, Noel.
Hi, Brian. So I've done the X-ray pictures. The fracture in the front leg is the least of her worries. The problem is that she is also affected by significant genetic problems. That hip dislocation that we noticed, that isn't due to the trauma, it's due to genetic hip dysplasia.
Yeah.
Neither hip is in the joint at all.
Yeah.
And you would have known about it in the next 2 or 3 months because she would have gone downhill.
Yes.
And also, she has significant problems associated with her airways. Have you noticed her snuffling or snorting?
Yeah, I thought that's normal with the breed.
Yeah. So, we have many problems here. Fundamentally, I'm just wondering whether it's morally right, whether it's ethically right to continue. And I didn't see this coming. I really didn't.
No, I understand.
So I guess the question for you and Lisa is whether you want to come back and talk to me tonight.
What we're saying, we're going to have to put her down, aren't we, now?
I think I did not see this coming, but I think that's...
I understand, it's not your fault, it's no one's fault.
I know, I'm coming back.
Okay, no problem. We'll wait for you.
Okay, thank you, I won't be long. Okay, bye.
Oh, my Lord.
In the prep area,
It's really sad.
Molly is being kept anaesthetised until her family arrive to say goodbye.
And I need Euthal. You stay here for now. In every case, we have a tightrope to walk between fixing the animal to get that animal out of pain and doing the right thing. And sometimes the right thing is euthanasia. And for me, it's an extremely distressing reality of everyday life as a vet. In a few minutes, I'm going to be holding Lisa in my arms with her sobbing her heart out. This is real life.
Lisa has arrived with her mother and brother.
Sorry. So this was something that I didn't see coming, and you obviously you didn't see coming. I absolutely know that. The problem is actually we rarely see it this bad. That's her lungs, and that's her heart, and this is her windpipe, and we've measured that windpipe, and it's only 5 millimeters wide, and in her it should be that wide. So basically, she's sucking air through a straw. The second problem is that her soft palate is too long for the size of her skull, and it's stopping the air going down properly down into the windpipe, and the windpipe's too small. So the lungs are sucking against a straw which has over the end of it a flap which keeps closing, and basically eventually she's suffocating because she can't get the air into her chest. And I've had my colleagues Susan and Porrick, who are both certified specialists, look at as well, because I didn't just want it to be my opinion, and then all three of us believe that the right thing to do is to let her go, because otherwise she's going to suffer. And the reason that I asked you, did you want to come tonight, was because I'm recommending that you let her go during the anaesthetic.
Yeah, that's why I wanted to come back. I don't want her not to be sedated.
I'm sorry, I'll bring her in.
Yeah, okay.
And you can spend as long as you like.
Yeah. Dear little thing she is. Mummy's girl. Mummy's girl.
Take your time, I'll give you a few minutes.
Oh, baby girl. Oh, she looks so sweet, don't she? Oh, yeah, you are. You're such a good girl. You're such a good baby girl. Oh, good girl. You.
beautiful girl. Night night, Molly.
For every animal that can't be helped, there are many more that can.
Good girl. Come on.
It's early morning, and Lola, the elderly beagle, is recovering from her spinal surgery.
Well done. Oh, you're such a good girl. So Lola's doing very well now. It's early days still, and considering the degree of surgery she's had, this is pretty good for day 5. She's still a little lame on her front legs, which is all normal at this point. Hopefully, she'll go from strength to strength now. There we go.
She's well enough now to go home.
We can go. Good girl. Come on. Hello, everybody, the entire posse. How are you doing? Our friend has been through the wars. We've got the obvious disc, and then we've got a mild bulge in the one behind that. And therefore, I fused both of them because I didn't want to have a problem. And you can see that there is a spacer device, which is like a corkscrew that goes in between those 2 vertebrae and between those 2 vertebrae. So I'll bring her in and I'll show you what to do. Now, who have we got here?
Hello, baby.
Now.
Hello, baby.
There we go. There we go. Hello, everybody. Hello. Oh, there we go. There's the tail wag. So she's doing great for where she's at. Now, expect that she's going to be lame on the front leg until all that pressure settles down around the nerves. And what must not happen is she must not do a Bambi, do the splits and go down on her chin, because she'll harm that until it heals.
Right, yeah.
That has to fuse. That's going to take 12 weeks. So just lots of rest. There we go. Look after yourself. All right, good girl.
She has got the 12 weeks rehabilitation. But I mean, it's just a positioning of all the pins and the discs, what they've put in now. If she has a fall, then it'll split open. Then good night, nurse. Good night, Lola. So we've got to be very careful with her.
Come on, let's go for a little walk.
Out in the field,
come on,
Brandy, who had a groundbreaking total knee replacement,
there we go. Come on,
is getting used to her new bionic leg.
You're such a good girl. Yes. We're a week post-operatively and all of the swelling's gone down. Oh yeah, she's beginning to use the leg reasonably well. It's a tough one because we're replacing the knee joint entirely from there to there. After all, we've dissected those muscles away from the bone, and those muscles have fallen down into a lax position because they're not held tightly properly. So reattaching those muscles is critical. Now it's all about physiotherapy, getting the knee to flex and extend without pain. All right, Boop. Good girl. Let's go. You can go home, sweetie pie. Now, who's here?
Hello, Brandy.
Who's here?
Helen and John have arrived to collect her.
There we go. There we
Hello,
go.
darling. Hello. You okay? Yeah. Dad's here. Yes, he is.
The main thing is that we get flexion and extension. We want...
Brandy will need a strict regime of physio and exercise for the next 3 months.
That's it. And exercise 2 is the walking. So what you're doing is you're walking slowly, so she has to lift her leg.
Ah, right, yes.
Right?
I
Move
know,
them.
I know.
Put that
we're
down.
Here. Yes, we are.
There's 2 things we're waiting to achieve. One is the healing of the muscle around the implant. The second is the bone growing onto the implant. As you can see, it's rock solid, and she's actually using it very well. Now, come on then. Good girl.
There you go, Brad. Good girl.
Are you in your sports car, missus? Well done. Good girl. All right.
It feels really great to have Brandy back. We've really missed her, so yeah, really pleased, aren't we?
Yeah, finally have her back and better get her home and give her lots of love. Make sure she's comfy.
Lots of tummy tickling. Thank you.
The surgical part of Brandy's journey is over.
Take care. Thank you. Just 2 weeks, please.
Now she faces the hard work of rehab to help her leg work normally again.
Yeah, they're having a little swim.
At the Fitzpatrick hydro pool, Brandy is having the first of a series of sessions.
Friends, what you got, love?
Noel wants to see how her leg muscles are healing.
Off you go. That's it.
Oh.
That's it. Yay.
Done. Good girl.
That's good. That's what I'm looking for. Her to pull against the water.
Yeah.
Makes a big difference.
I can see that, yeah. Good girl.
All right, there we go.
Well done, Brand. Good girl.
It's 6 weeks since she had her bionic knee implant fitted, so she's also having scans to check everything is stable.
So I'm very pleased with this. We can see wonderfully that the bone is physically growing down around the collar. So that is bone integrating with metal. Wow. Yeah. This is a one-off. No dog in the world, to my knowledge, has ever had this implant. It's going really well from a biological perspective. From a functional perspective, it still has a way to go.
Yeah.
I mean, all around it's good news.
Yeah.
Well done, guys. Okay.
Brandy still faces 6 more weeks of intensive physio and hydrotherapy.
God bless. Take care, Brandy. Bye.
It feels like we're on a long road to recovery now, but she's still got a way to go with in terms of the range of movements.
Hopefully she's got her best chance in life now. You feel so relieved, it's so happy, it's so nice to have her back to being a normal girl. You ready? Backwards in we go, so you can't see where we're going. Right, and then we... Oh, there we go. Good girl. Go. Come on, Lola. Come on. Come on, baby. Come on. Here we go. Lola.
In Surrey, it's been 3 months since Lola, the elderly beagle, had the operation to fix 2 damaged discs in her neck.
Come on, Gorge. What's that here? Come on. That's good stuff.
Now she's back home and roaming the estate once again.
Run, Lola. Run, 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 run. Yeah, good girl.
Lola's really happy to be back at home and wandering around on her land.
Yeah, patch. A manor. She's stronger. She's going to get some biscuits. She's progressively getting better each day, so she's getting into the rhythm again of what she used to do. Come on. Come on, let's go and get it.
She's a little bit slower. She's more careful.
Come on, baby.
Which is good. So she's being sensible.
Come on. The idea was to give her another short lease of life, or a lease of life to what she's got. She's got that now. Come on, where are we going? Where are we going? And it was the right decision to make. What's up here? We know she's happy. I mean, she was miserable when she was ill. She's past that. And you mean the next 18 months, hopefully, it'll be a good time for her. Let's go, Brands. Good girl.
In Staffordshire, it's 3 months since Brandy had the operation to remove her tumour.
Right, Brands, you ready? Good
and have a bionic knee fitted. She's free of cancer and once again riding out in style.
Good girl.
John and Helen can now take her out for the walks she loves.
Brandy's doing really well. She's like almost back to going on normal.
Doing well, Brandy. Good girl. I think that's the thing. She's now gets back to doing all the same things she's done before, which is smells and sights and chewing sticks, and obviously going for swims in lakes. Good girl.
It will take time and exercise for Brandy's muscles to fully recover.
Here we go, Brands. You ready? Go.
But now she's doing her own hydrotherapy.
Done.
I don't think we could have wished for anything else, but this is like it was the best outcome possible, really, that she's now free and she can run around and swim and do all the things she used to do. And the most important thing is that she's happy.
Oh, thank you, Brands.
Oh, Brandy.
Come on, let's get you dry. Sit down, love. It's given us all that sort of what we enjoyed back again, hasn't it? So, yeah, it's been great. Really good. Yeah, good girl. I think there's a big worry is over now, that we feel like we can just enjoy the remainder of her years and, you know, all the things we wanted to do and have a great time, really, and have really, you know, hopefully many, many years ahead. You like that? You do. Okay. Is it good? Is it nice?